International tension is growing with an increased threat of military conflict. Last night, North Korea tested a nuclear bomb. We are at war with Iraq. Iran is also a huge threat in that region. The question to you as a candidate is, how should Congress respond and work with the current administration in easing current threats?
I'm the only Native American woman running in the entire country for an office at this level, and I think we need to apply some Native woman common sense and toughness to this issue. First of all, we have to quit the bickering in the House between the Republicans and the Democrats, and if we don't come together and work with the administration and make sure the administration pays attention so that we can conduct some oversight, that we have some active foreign affairs, that we practice this diplomacy over force, and that we have our National Guard here in the state of Alaska so that they can be looking out for our front lines here at home, and also that we need to clean up the issue in Iraq. Now, this is tough to try to solve the world problem in 60 seconds, but I'm doing my best. They call for an exit strategy. Well, let's see one, because we haven't seen one so far. We need to get our folks home from Iraq.
Okay, Diane, I'm going to go ahead and ask you the second question. So since our candidates have already answered 2 questions, we'll ask you your second one also. Indian healthcare is eroding with cuts in real funding and a diminishing number of healthcare professionals, such as we see at Chief Andrew Issac Health Center here in Fairbanks. Question to you is, how do we address this problem that is very likely to grow?
Wow. We have a serious budget problem simply because of the war. And I can tell you that I've worked with the National Congress of American Indians, as well as taking advice from those who have solid advice to give. Look at the state like Massachusetts, where the governor just instituted a mandatory health insurance and implemented a plan, an affordable plan, so that all people in that state could have access to health care. I think this would diminish some of the fight over the funding, and that Alaska Native people must have the commitment from the federal government, and I can tell you for a fact I would fight for that. I know what that implication means firsthand, so it would make it a top priority to deal with health care, not just for all, but really focus on the commitment to Alaska Native tribes and the tribes across the nation.
Thank you. We'll ask you the third question after we get done with the candidates. Our third question to the